member of one of the subcommittees of the Sierra Club that was meeting here in Charlotte. And one night I noticed that air pollution was no longer on the agenda. And I asked the chair, I said, why isn't air pollution still on the agenda? And he said, well, we've already finished that project. There's nothing else to do. I said, what do you mean there's nothing else to do? There's always something to do about air pollution and cleaning up our air. And so I looked around the room and I said, is there anyone here who would like to continue working with me on clean air issues? And 3 young men, and I say young men because they were at least 10, 20 years younger than I at the time, raised their hands. And after the meeting, we got together and talked about who we were and why we were interested in clean air issues and what we would like to do about it. So that evening dinner meeting was the genesis of Clean Air Carolina.
Clean Air Carolina's initiatives, we have a few. Clear the Air for Kids, which is obviously geared towards school-age children and improving the air quality for them. We do special events where we'll have guest speakers in. Dr. Sandra Steingraber, we had an event with her over at Providence Day School.
My first asthma attack was when I was 6 years old, and I was on a trip to New York with my family, and we were walking down one of the streets, and my sister and I were running ahead of my parents, and all of a sudden I just felt really short of breath, and it was like I just couldn't get enough air in my lungs, and I just couldn't breathe. And at that point I didn't even know I had asthma, so I was really just scared and I didn't know what was happening. And then when we got back, I think my parents could tell that it was an asthma attack, so we went to the doctor and I was diagnosed. So now whenever I exercise, or if I'm ever going like uptown or like anywhere where it's really polluted or like there's lots of traffic, then I have to use my inhaler. So I really just bring it with me anywhere I go because it's the only way to ensure that I'll always be able to breathe fine without any problems.
Hi, I'm Eli Olson and I have asthma. My first asthma attack was in 3rd grade, and we were on the playground and all of a sudden I couldn't breathe. And so my parents had to come get me and take me to the hospital.
Name?
Hi, I'm Sidra, and I have asthma.
When was your first asthma attack?
Probably when I was like 9.
And what happened?
Well, I was sick, and I was having a lot of trouble breathing, and my doctor called it wheezing syndrome, I think, for like insurance purposes, but it actually ended up being asthma, and I've had problems with it ever since. I used to live right outside of Raleigh, but it was in more of a town area. It's called Wake Forest, and I didn't have a lot of asthma problems there. It was more exercise-induced. But since I've been in Charlotte, in a big city, which is more polluted, I've had way more problems with my asthma and allergies, and had major problems breathing and stuff since.
So thank you for what you're doing, Clean Air Carolina, because without your help, I don't know how I'd be able to breathe.
Thank you, Clean Air Carolina, for what you were doing, because you're helping me breathe.
With reduced use of CO2 emissions and fossil fuel, I would have a lot better time breathing. Thank you for what you're doing, Clean Air Carolina.
This is an organization of healthcare professionals which supports Clean Air Carolina and supports the organization which is working to improve the air quality for the people of the greater Charlotte area.
Medical Advocates for Healthy Air, which is engaging 400 medical doctors around the state, trying to change policy and make the public aware of the air quality issues that we have here.
As a cardiologist, I'm most concerned about heart disease, and I can speak to that directly. Air pollution obviously can affect the lungs. In terms of the heart, air pollution is considered a risk factor for heart disease. And air pollution, particularly ozone, gaseous air pollution, and microparticles can influence the course of atherosclerosis, which is the process of artery hardening that can lead to a heart attack. And basically what happens is the small particles get into the lungs and then get into the bloodstream, and these particles have an effect on the blood vessels, causing increased inflammation, and can actually promote atherosclerosis, which is the hardening of the arteries that leads to heart attacks. Air pollution can have a major impact on health, specifically lung diseases like asthma, patients who have chronic obstructive lung disease, which is a condition that's often caused by cigarette smoking, but can be caused by other factors. And these individuals basically are even more sensitive to the effects of air pollution. Individuals who are immunocompromised, who are elderly, who are weakened in one way or another, can also be more sensitive to the effects of air pollution. So I think
supporting clean fuels, mass transportation, and clean construction. Obviously, Charlotte's growing rapidly. We've got a lot of construction going on, whether we're building new hospitals, office buildings, and getting those developers, construction companies to use equipment, use trucks that are cleaner burning as opposed to the old sort of diesel